Hi, my name is Lily Holland. I'll be doing my trach sectioning video today. Before I get started, I'd be sure to follow my GPSPs and do my 2 patient identifiers. So I'm gonna go in the room. Hi, my name is Lily. I'll be doing your trach sectioning today. Can you tell me your name and date of birth? And that matches out. And I'm gonna go ahead and perform a respiratory assessment before I get started. So I'm going to listen to lung sounds. I'm going to do the 10 spots on the front. And then I would do the 2 on the side, and if the patient were able, I would sit them up and do the 10 on the back. So, are you in any pain today? They said no, but with the respiratory assessment, I heard crackles in the lungs, so that indicates for suctioning. So, first thing I will do is I will put on a chucks over the patient's chest. And then I will turn on my suction. The patient is an adult, so the suction will be 150. If they were a child, it would be 125, and for an infant is 100. I will also turn on my oxygen. And then next I'm going to set up my supplies. So I'm going to go ahead and perform hand hygiene and put on my face shield. I'm going to open my catheter kit, my suction catheter kit, and get out my sterile cup. And I'm going to lift the sterile saline and pour it into my cup. And then I will perform hand hygiene and open my kit. And I'm going to put on my sterile gloves. And then I will get my catheter out. Keeping it in my dominant hand to maintain sterility, I will attach it to my suction and put the end of the catheter into the sterile saline, testing my suction, and it works. So next, I will hyperoxygenate the patient. I'm going to give them 3 breaths. Okay. Once I've given their breath, I'm going to insert the catheter without suctioning. And once I get the catheter inside the trach, I will do intermittent suction while rotating the catheter and withdrawing, and I wouldn't suction for more than 10 to 15 seconds. If the patient needed additional suctioning, I would not hyperoxygenate them more than 3 times, but they don't need any more additional suctioning. So after that, I will clean up my supplies. And I would dispose of my supplies properly, perform hand hygiene, and perform another respiratory assessment. I'm going to listen to the 10 spots on the front again. And then I would also do the 2 on the side and the 10 on the back. I would also assess their respiratory rate, their O2 saturation, and their respiratory effort. Once I've finished, I would perform hand hygiene, clean up my supplies, and document immediately.